I think it's really important for people who suffer with autoimmune arthritis to take advantage of the resources available to them. Autoimmune arthritis is a disease of the joints in the body. It is your immune system attacking the joints themselves, attacking specifically the synovium or the lining within the joint.
Autoimmune arthritis is a broad category of diseases, and a lot of the manifestations can occur in the hand and the upper extremity. The ones that I typically see or that are more common are things that have to do with psoriatic arthritis or rheumatoid arthritis.
There are actually 1.3 million people in the United States with rheumatoid arthritis. 75% of those are women. It's really important for treatment that they understand which one you have, which one the patient has, because they all present, there's a lot of general symptoms, which all of them will present with, but some of them have very specific symptoms. Some of them mimic osteoarthritis, which is the other type of arthritis, which is just a wearing out of your joints, and that is kind of a global joint. It's, the wear and tear from living. And both of them will have stiff joints, they will have sore joints. The difference with an autoimmune disease is that's not where it'll stop. Many times, first off, you have flare-ups. You'll have episodes where it's worse than other times. You can have red hot joints, you can have a fever, you can have fatigue and global weakness. You feel ill when you're in a flare-up. Certain types of autoimmune arthritis will have GI issues, some will affect your eye. The second most common autoimmune arthritis is called psoriatic arthritis, and your skin is dramatically affected. So clearly, like when you're in a flare-up with autoimmune arthritis, you're not just having stiff, sore joints. You're really not feeling well at all.
The mainstay of treatments now are mostly medical. There are medicines out there that can keep patients very functional, very pain-free, without developing the problems that occur without those diseases being treated appropriately. Treatments, usually modalities, including hand therapy, medical treatments, and surgical and non-surgical treatments.
Proactively, before your osteoarthritis and or autoimmune arthritis get to the point where it's dramatically affecting function, if you have intervention from a certified hand therapist or an occupational therapist, we can adapt your environment. We can show you adaptive equipment that will help, for example, opening a jar. We can teach you stretches and strengthening exercises to maintain the function in your hand. We can split you if you've already started deteriorating and your joints are stiff and sore, to kind of help you either regain or maintain what you have. I think the resources in the community, the resources on the internet, the resources in just therapy in general can really help you. The American Arthritis Foundation and the Autoimmune Arthritis Foundation of America have an enormous amount of information for these patients. Everything from, catalogs for adaptive equipment to, pool programs at the YMCA specific to these types of issues. Empower yourself with knowledge about your disease, about what's available to you within the community, on the internet, within the medical profession itself. And know that you can live with it. You really can live with it. And it's not a death sentence. You're not going to not be able to do what you want to do. You just need to do some things beforehand to be able to.